Hello, and welcome back to our daily English talk. I'm really glad you are here with us today. This is a calm and supportive place where you can practice English slowly. Please take a gentle breath and relax your shoulders.
Hi, everyone. We're happy you're here. There is no rush and no pressure. This lesson is slow and clear. Just listen and stay comfortable.
If you are new here, please remember to like this lesson and subscribe to our channel. Your support helps us continue creating helpful English for real life. Thank you very much.
Yes, thank you for being here.
Hello, and welcome back to our daily English talk. I'm really glad you are here with us today. This is a calm and supportive place where you can practice English slowly. Please take a gentle breath and relax your shoulders.
Hi, everyone. We're happy you're here. There is no rush and no pressure. This lesson is slow and clear. Just listen and stay comfortable.
If you are new here, please remember to like this lesson and subscribe to our channel. Your support helps us continue creating helpful English for real life. Thank you very much.
Yes, thank you for being here. This space is for learning without fear. You do not need perfect English. You only need patience and calm attention.
Emma, how are you feeling right now? I feel calm, but thinking about hospitals always makes me a little serious.
I feel the same way. Hospitals are important places. People go there when they need help, so it can feel a bit stressful.
That feeling connects to today's topic. Today, we will talk about being at the hospital. This is very useful English for beginners.
Yes, hospitals are places we all may visit one day. Knowing simple English for hospitals helps us feel more prepared.
Many English learners feel nervous about hospitals. They worry about explaining problems. They worry about understanding questions.
That worry is very normal. Health situations are serious. Using another language can feel difficult.
The good news is this. Hospital English does not need long sentences. Short and clear sentences work best.
Yes, doctors and nurses use simple language too. Clear communication is very important in hospitals.
Today's lesson is listening practice. You do not need to speak. Just listen and imagine the situation calmly.
Listening calmly helps the brain feel safe. When the brain feels safe, learning becomes easier.
Let's imagine we are going to the hospital together today. Maybe we do not feel well. Maybe we need to see a doctor.
I imagine waking up and feeling unwell. My body feels weak. I know I should go to the hospital.
We arrive at the hospital building. It is large and busy. People are walking in and out.
I see signs on the walls: emergency, reception, pharmacy. The signs help guide people.
We walk inside the hospital together. The space feels bright and serious. The smell of clean air is strong.
I hear quiet voices and footsteps. The hospital feels busy but organized.
I pause for a moment and take a slow breath. Breathing helps calm my body.
Calm breathing is important here. Hospitals can make people feel tense.
I look around and notice a front desk. A receptionist is sitting there helping patients.
Seeing staff makes me feel safer. People here know what to do.
Before speaking, I think about my problem. Maybe I feel pain. Maybe I feel dizzy. Preparing words helps.
I prepare simple words in my mind: pain, fever, stomachache. Simple words are enough.
I remind myself that I do not need medical vocabulary. I only need to explain how I feel.
That reminder helps reduce fear. Clear meaning matters more than perfect grammar.
I walk slowly toward the reception desk together. My steps feel careful.
Walking together feels supportive. Hospitals can feel scary when alone.
I notice how people speak quietly in the hospital. Quiet voices help the space feel calm.
I remind myself to speak slowly and clearly. Slow speech helps understanding.
I also remind myself that pauses are okay. I can stop and think. Silence is allowed here.
Silence is very normal in hospitals. No one expects fast conversations.
Being at the hospital does not require long conversations. Staff will ask clear questions.
Yes, we only need to answer honestly and simply.
I think about learners listening now. Hospitals in English can feel frightening.
But you are not alone. Many people feel nervous in hospitals, even in their own language.
Calm preparation makes a big difference. Imagining the steps helps reduce fear.
Listening to this lesson helps you feel prepared without pressure.
I notice my breathing feels steady now. My body feels calmer.
I feel calmer too. Preparation makes the situation feel manageable.
I feel ready to speak with the receptionist now. My mind feels clearer.
I feel ready as well. Calm listening helped us reach this point.
In the next part, we will talk to the receptionist and check in at the hospital using simple English.
Yes, we will continue together. Please stay relaxed and keep listening. You are doing very well already.
Now we are standing calmly at the hospital reception desk together. The receptionist looks up from the computer and waits patiently. I take one slow breath before speaking. Breathing helps my voice sound steady and clear.
I stand next to you and feel a small nervous feeling inside. It is not strong, but I notice it. Hospitals can feel serious places, but this moment feels calm.
I begin with a polite greeting. I say hello slowly and clearly. Starting politely helps the conversation feel respectful and safe.
I notice the receptionist smiles back. That smile feels welcoming. Friendly faces help nervous feelings become smaller.
I explain why I am here using simple words. I say I need to see a doctor. I do not rush my sentence. Short sentences feel safer.
Simple language works very well here. The receptionist understands immediately. There is no confusion.
The receptionist asks for my name. The question is clear and expected. I answer slowly and clearly. I spell my name if needed.
Spelling names is very common in hospitals. Records need to be correct. Taking time feels responsible.
The receptionist asks if this is an emergency. I listen carefully before answering. Listening first helps calm the mind.
This question is important. Hospitals need to know how serious the problem is.
I answer honestly. I say yes if it is serious or no if it is not. My answer is short and clear.
Honest answers help staff decide what to do next. Clear information matters.
The receptionist asks what problem I have. This is the main question. I prepared simple words for this moment.
Preparation helps reduce fear. Knowing what to say makes the body relax.
I explain my problem slowly. I say I have pain. I say where it hurts. I use simple body words.
Body words like head, stomach, chest, or leg are very useful in hospitals.
I also say how long I have felt this way. I use simple time words, since yesterday, for 2 days.
Time words help doctors understand the situation better.
The receptionist listens carefully and types information into the computer. I wait quietly. Waiting feels normal.
Yes, waiting is common in hospitals. Silence is normal and expected.
The receptionist asks if I have an appointment. I answer honestly with a simple yes or no.
Short answers work well here. The receptionist only needs the facts.
The receptionist asks for my identification or insurance card. I listen carefully and respond calmly.
Hospitals often ask for documents. This is normal and routine.
I hand over the card slowly. My movements feel careful and calm.
Calm movements help the body stay relaxed.
The receptionist gives me a form to fill out. I take the paper and a pen gently.
Forms can feel stressful, but they are usually simple. We can take our time.
I sit down at a small desk and read the form slowly. I answer basic questions about my health.
Taking time helps reduce mistakes. There is no rush.
When I finish, I return the form to the receptionist politely. My voice feels calm.
Calm communication helps everything move smoothly.
The receptionist tells me where to sit and wait. The instruction is clear and gentle.
Clear directions help reduce confusion in busy places like hospitals.
Before leaving the desk, I ask one simple question. I ask how long the wait might be.
Asking questions is allowed. Staff expect patients to ask.
The receptionist answers calmly and gives an estimate. Hearing a clear answer helps my body relax.
Knowing what to expect makes waiting easier.
I say thank you politely and step away from the desk.
Saying thank you closes the conversation in a kind way.
We walk to the waiting area together. My steps feel slower and steadier now.
The hardest speaking part is finished. That feels good.
I sit down carefully on a chair. Sitting helps my body rest.
Sitting quietly helps breathing slow down.
I look around the waiting area. People sit quietly. Some look tired. Some look worried.
Hospitals are emotional places. Many people feel different things here.
I remind myself to stay calm and patient. Waiting is part of the process.
Calm waiting helps reduce stress.
I reflect on the check-in conversation. Simple English worked well. Clear meaning was enough.
This shows that hospital English does not need to be difficult.
I think about learners listening now. Checking in at a hospital in English can feel scary.
But you can do it step by step. You can speak slowly. You can pause.
Hospital staff are not judging your English. They focus on helping your health.
Remembering that reduces pressure.
I feel ready for the next step now. Waiting to see the doctor feels manageable.
I feel ready too. Calm preparation helped us reach this point.
In the next part, we will meet the nurse or doctor and talk about symptoms calmly.
Yes, we will continue together. Please stay relaxed and keep listening. You are doing very well.
Now we are sitting quietly in the hospital waiting area together. Time feels a little slower here. My body feels calm, but I still feel a little serious inside. Waiting feels normal in this place.
I feel the same way. Hospitals make people quiet and thoughtful. Sitting calmly helps my breathing slow down. Calm grows little by little.
I look around the waiting area again. Chairs are placed neatly. People sit quietly with their thoughts. The room feels serious but organized.
I notice nurses walking by. They look focused but kind. Seeing them helps me feel safer.
I hear my name being called clearly. The sound is calm and professional. This means it is time to see the nurse or doctor.
Hearing your name makes my heart beat a little faster, but it does not feel scary. It feels like the next step.
I stand up slowly from the chair. Standing slowly helps my body stay balanced and calm.
I stand up with you. Moving slowly feels right here. Hospitals are not places to rush.
I think. A nurse smiles gently and asks us to follow. The gesture is clear and kind. Gestures help communication feel easier.
I follow quietly. The hallway is bright and clean. The sound of footsteps echoes softly.
We enter a small examination room together. The room feels clean and simple. There is a bed, a chair, and some medical equipment.
I notice the clean white walls and the quiet machines. Everything looks serious but safe.
The nurse asks me to sit or lie down. I follow the instructions slowly. My body feels supported.
The nurse speaks in a calm voice. Calm voices help nervous feelings fade.
The nurse asks me how I am feeling today. The question is simple and caring. I listen carefully.
Listening first helps choose the right words. Taking time feels allowed here.
I explain my problems slowly. I say I feel pain. I say where it hurts. I use simple body words.
Words like head, chest, stomach, or back are very helpful. Simple words are enough.
The nurse listens carefully and does not interrupt. That patience feels reassuring.
Feeling listened to helps the body relax. Fear becomes smaller.
I think. The nurse asks how long I have felt this pain. I pause and think. Pausing feels natural.
Simple time words work well here. Today, yesterday, for 2 days.
I answer honestly and clearly. My voice stays calm and steady.
Honest answers help medical staff understand the situation better.
I smile. The nurse asks if I have other symptoms: fever, dizziness, nausea. I listen carefully.
These questions are common. Nurses ask them every day.
I answer yes or no. I do not explain too much. Short answers feel safe.
Short answers are perfect here. The nurse will ask more if needed.
The nurse checks my temperature and blood pressure. The actions are gentle and quick.
Medical checks can feel strange, but the nurse explains each step calmly.
I smile. The explanation helps me relax. Knowing what is happening reduces fear.
Clear explanations build trust between patients and staff.
I think. The nurse tells me the doctor will see me soon. Hearing that feels reassuring.
Knowing what will happen next makes waiting easier.
After a short wait, the doctor enters the room and greets us politely.
The doctor's calm voice and friendly greeting help me feel more comfortable.
I smile and return the greeting. My voice feels steady now.
Calm posture and calm voice work together. Everything feels under control.
I think. The doctor asks me about my symptoms again. I listen carefully and answer simply.
Repeating information is normal. Doctors need clear details.
I describe my pain again. I point to the place that hurts. Pointing helps communication.
Body language supports words when language feels limited.
I smile. The doctor asks questions about pain strength, mild or strong. I answer honestly.
Describing strength helps doctors understand how serious the problem is.
I think. The doctor listens carefully and nods. That nod feels reassuring.
Being understood reduces worry quickly.
The doctor explains what they think the problem might be. The explanation is simple and clear.
I focus on the main idea. I do not worry about every word.
Understanding the main idea is enough. Doctors guide the conversation.
Yes, patients do not need to understand every detail.
I think. The doctor suggests a test or treatment. The words are calm and clear.
Clear suggestions help the mind feel organized.
I ask one simple question about the treatment. My voice stays polite.
Asking questions shows care for your health. Doctors expect questions.
I smile. The doctor answers patiently and kindly. The tone feels supportive.
Supportive voices help patients feel safe.
I think. The doctor says we are finished for now. The visit feels calm and complete.
I take a slow breath and notice my body. I feel calmer than before.
Calm communication made a big difference.
I reflect on how simple English worked well. I did not need difficult words.
Simple English is enough for hospital situations.
In the next part, we will leave the hospital and reflect on the experience together.
Yes, we will finish calmly. Please stay relaxed and keep listening. You are doing very well. Now we are slowly leaving the examination room together. I feel a sense of relief in my body. The most difficult part of the hospital visit is finished. My breathing feels deeper and calmer.
I feel that relief too. The nervous feeling that was there earlier is much smaller now. Knowing what happened and what to do next feels comforting.
We walk quietly down the hospital hallway toward the exit. The hallway feels familiar now. Earlier, it felt confusing and serious. Now it feels calm and normal.
Familiar places feel safer. When fear is gone, everything feels softer. The hospital feels less scary now.
We stop briefly at the nurse's desk. A nurse looks up and gives a polite smile. This final interaction feels simple and easy.
Speaking again feels natural now. Confidence grows quietly when we take small steps.
The nurse explains the next steps slowly. Maybe there is medicine to take. Maybe there is a follow-up visit later.
I listen carefully but calmly. I focus on the main ideas. I do not worry about every detail.
I nod to show I understand. Nodding feels easy. Body language supports communication once again.
Body language is very helpful in hospitals. Even small gestures show understanding and respect.
I receive a paper with instructions. It explains when to take medicine or when to rest. Holding the paper feels reassuring.
Written instructions help a lot. They reduce worry about forgetting important information.
I say thank you clearly and politely. My voice sounds calm and natural now.
Saying thank you feels sincere. It closes the hospital visit in a kind way.
We walk toward the hospital exit together. The doors open slowly. Light from outside fills the space.
Stepping outside feels refreshing. Fresh air touches my face. My body feels lighter.
As we walk away, I notice how my body feels. I may still feel a little tired, but I feel calmer and safer.
Calm makes physical discomfort easier to handle. Worry often makes pain feel worse.
I think about the doctor's advice. Rest more, drink water, take medicine as instructed.
The advice feels simple and manageable. Simple care steps feel comforting.
I remind myself that going to the hospital was the right choice. Taking care of health is important.
Yes, listening to our body is important. Hospitals are places for help and care.
I reflect on the whole experience, from entering the hospital to leaving now. Each step felt manageable with calm thinking.
Calm preparation changed everything. Even speaking English felt possible and natural.
I remember how nervous I felt at the beginning. That nervousness feels far away now.
Experience builds confidence. One calm visit makes the next visit easier.
I think about learners listening now. Being at a hospital in English can feel very scary.
But this conversation shows it can be calm. Simple English and slow speech are enough.
You do not need advanced medical English. You only need to explain how you feel.
Doctors and nurses ask clear questions. You only need to answer honestly.
You are allowed to pause. You are allowed to ask questions. You are allowed to take your time.
These are signs of good communication, not weakness.
I feel proud of how we handled this hospital visit, not because it was perfect, but because it was calm.
Calm success builds real confidence. Quiet confidence stays with you.
I realize again that English is a tool for daily life. It helps us take care of our health.
When language supports real needs, learning becomes meaningful.
I feel grateful for this experience. Even a hospital visit can become a learning moment.
Each experience builds strength and confidence.
I hope listeners feel encouraged now. You can go to the hospital. You can explain your problem.
You can stay calm. You can speak slowly. You can trust yourself.
Learning English through real-life situations builds confidence that lasts.
Confidence grows step by step, just like today.
I feel peaceful as we walk away from the hospital. The experience feels complete.
Calm endings help memories settle gently. This feels like a good ending.
Thank you for staying with us through this full conversation. Thank you for listening patiently.
Yes, thank you for being here. Your effort truly matters.
We will meet again in another lesson. Until then, take care of your health and yourself.
Goodbye for now. One calm step at a time.